Okay, good afternoon. I am thrilled today to have with us Tom Wyatt, who is Chief Executive Officer of KinderCare Education. KinderCare provides early childhood education and school-age programs for more than 185,000 children across the country in over 2,300 locations. As we all know, child care providers have been on the front lines of the COVID-19 crisis, and many of them have stayed open to care for other essential workers' children. Others have unfortunately closed, some permanently, some have an unclear future. And as an organization, First Focus on Children knows how vital child care is in this country. The COVID-19 crisis has made that even more apparent. The childcare sector, however, was in a precarious position prior to the pandemic as well. And we want to start there in our conversation with Tom. So Tom, again, welcome and thank you. And my first question for you is, as CEO of one of the largest childcare providers in the country, what are some of the biggest challenges you were already facing prior to the COVID-19 pandemic?
Happy to take that, Avery, and it's a pleasure to be here. We really have two large challenges that have faced us, quite frankly, for the total time of our existence. First is really affordability and access. The second one is talent access and workforce issues. Let me take affordability and access first. As you know, childcare is an essential workforce support group. Without us, families can't go back to work, and it will slow down the economy. Yet Americans really do lack access to high quality, affordable care for a number of reasons, cost being the largest one, but also there are areas of the country that don't have a number of, if you will, footprint large enough to really take care of the demand in those areas. And all of that's been made worse through the pandemic. The cost of providing child care is a very expensive ordeal. The labor involved in this, because of the ratios that we do in our classrooms, the actual work that we do with children, literally the length of time that we have children in our centers, which can be 10 to 12 hours a day, really puts a burden on the cost of labor in our model. The pandemic has really put providers in a very precarious financial position because, quite frankly, now we're having to add more labor for health and safety purposes, for the lower ratios that we're working in today because of state mandates that we're going through. So there's really been a very challenging time for us, literally since March of this year, and even as we started to open centers in June and July. There are predictions out there today that say that we'll lose 20 to 50% of our capacity or our centers during this pandemic. And quite frankly, we've already witnessed a number of centers that have closed and candidly will not reopen. Public funding for this industry is critical to close the gap for these issues, if you will, what families can afford, and the opportunity and the, if you will, the spectrum of how many high quality care units are out there, centers are out there. It's more important than ever for lawmakers to consider a few things, and we've discussed this with many folks in the Senate and in the House. First being a short-term, if you will, stabilization fund for child care. We believe it should be grants, and it's a fund to help us deal with the impact of the pandemic, the cost of labor, the cost of actually shutting down our centers, which I'll talk about in a minute, but also PPE, all the things that have really been an increased cost to us. We need help to get back on our feet. From a mid to long-term standpoint, increasing child care credits for the middle-class families, the ones that we call private pay, those families really do need help. Many of them lost their job during the pandemic. Many of them took salary reductions and candidly are struggling financially to get back to normalcy. We also, in fact, in KinderCare, I'll share with you that about a third of our families are actually benefiting from the Child Care Development Block Grant, CCDBG for short, which is a block grant that has been around for many, many years that supports low-income families. So about a third of our families, the children in our centers, are from that area. Long-term, from an infrastructure standpoint, we believe we need to create infrastructure grants and partner with the private sector to build supply in the child care deserts. I live in Oregon, and I will tell you, I talk to Senator Ron Wyden all the time about the work that we need to do in the rural parts of Oregon, where there is literally no sites for these children to take advantage of, certainly no high-quality sites. So those are really the key things there. From a workforce issue standpoint, attracting and retaining teachers today is critical, and it's a very difficult task for us. And we really believe there are a few things that we can do to make that easier for us and, quite frankly, more rewarding for the educator. One is to create a standard credentialing, if you will, to recognize across our states and the federal government, federal funding streams, and to incentivize providers to actually subsidize that. We have an opportunity to do that for all of our teachers, which will also raise the credibility and, if you will, the standards in the classroom. We also think that apprenticeships, where we could take our educators and they could actually be incentivized to participate in an apprenticeship program. Providers would receive tax credits maybe, or grants to offset the expenses of that. But that too could help us create a higher quality experience for families. And then the last one is tax credits. If we could create a national refundable tax credit for early childhood educators working in this environment, licensed high quality centers, makes a lot of sense to us. And we think that would help us incent people to get into this industry. Bottom line, the nation is facing an ever-growing child care crisis, and it's something that we need to address. And it was exacerbated by the pandemic. So we're looking forward to hopefully seeing lawmakers help us address these things with the funding they have.
Thanks, Tom. That's a lot. During the pandemic, I think, as I said in the opening, we know childcare is absolutely essential to our economy. And one of the few benefits that I think possibly could be happening is that is becoming a realization more and more people are understanding. Do you feel like certainly in the pandemic, but in the last few years, do you feel a shift in the appreciation for childcare and the recognition that it's absolutely vital to our economy for a number of reasons? Do you see sort of a wave changing here?
Yes, we do. One of the heartfelt things that we got out of the pandemic is, quite frankly, both the realization of from Congress as well as parents how incredibly important we were to the infrastructure of that family unit. Families have gone through a lot. Children have gone through a lot over the last 7 months. And we have seen an incredible respect come from this. Give you an example, KinderCare, we'll talk about this more in a little bit, but we closed the vast majority of our centers back in March because nobody was coming to those centers. But we left a number of them open, which we'll get into in a minute. But we did that for essential workers. And the amount of dialogue, the amount of appreciation, the number of emails, phone calls that I received thanking me, because we had doctors, we had nurses, we had supply chain specialists, we had a number of people that were keeping all of us alive and functioning, that without childcare, they didn't have an option. They don't live close to their parents. They don't have other people in the community that can take care of their children, and they have to go to work. And their work is not working from home. So yes, we felt a incredible amount of appreciation for the services we provide. And the high quality that not only do we actually help the child in a nurturing environment, a normalcy environment, but we're also educating the children. So it's a very important part of the development of a child. Yeah.
I think that I'm glad to hear that. I think that sort of appreciation and realization is helpful on the ground, and then that also trickles us up or down to Congress and lawmakers, and that can help a lot. Are there any, you mentioned that centers have closed and have had to take on new challenges and costs. Are there any other burdens or challenges that centers have felt? We've heard of course, we talked about some have closed, some we understand have taken on debt. They've had to reduce enrollment. Are there any other sort of on the ground specific challenges they've had to face?
Yes, and let me just sort of tell you the KinderCare story since March, Avery, and I promise I won't take you too far deep into it. But back in March, we were serving 185,000 children in our centers, actually 187,000 children at that point. It was a peak of number of children we've ever had in our centers over the 50-year life of our company. And the following Friday, March 13th, 187,000. March 20th, we had 13,000 children in our centers. So it was it decimated our centers, quite frankly, and obviously impacted our business critically. And we decided during that week, as we saw this happen, that we had to do a couple of things. One, we had to furlough a number of employees, which was very difficult, but necessary to survive. We also had to take into account, we wanted to take into account, candidly, how do we serve these essential workers that we were hearing so much about, particularly in the medical field, but also supply chain, grocery store, industry, what have you. And we needed to be sure that we were there for them because it's our mission. We support families. So we went through all that. And throughout that time, we kept, of our 1,500 total centers, 2,200 in total, including our before and after school program. But of all of our centers, we left 400 open during that time, all 400 losing money. But we felt like it was the right thing to do. So we went through that. We bought the PPE. We did the things that we needed to do around training of new safety and health protocols. We worked closely with the CDC. That was an investment for us. So all of these things were adding up at a time when our revenue was down 90%. So we went through that time. It was an important time for us. Since June, we've opened every single one of our centers. We are, at this point, open and operating every single one of them. And some are operating at a break even, but many are still operating at a loss even today because of the standards that were set by the states that we're operating in. So from a standpoint of what we feel like needs to be done from the financial support point of view and what could help with parents, there are things that we want to prioritize and talk about. One is increase in the child and development care tax credit. That tax credit helps the, if you will, middle income families afford the cost of child care. So we think that would be a very important part of what we've already talked to Congress about. Also, the creation of a young child tax credit would help young families afford the cost of high quality child care. It's important because this is a significant, many families, lower middle income families who are burdened by paying all of the tuition. Quite frankly, this is larger than their house note. This is the most expensive cost that they incur on a monthly basis. So anything that we can do to help them would be incredible. We also believe that employers, and many do, by the way, employers should be incentivized to subsidize the cost of care. We have a number of employers that we work with, that we have centers on site of their corporate offices. We have other widely dispersed employers that also incentivize, quite frankly, their employees to take advantage of child care and create and subsidize it to a degree, which we think is a great way to put it into the benefits package that, the young generation, particularly millennials and Zers who are now obviously coming into the marketplace and really do want a more holistic view of the benefits that companies offer them, and childcare is one of them. So we believe all of that should be a part of what we do. We're convinced that increasing tax support is a good economic investment. We believe it'll pay dividends. Childcare is a holistic part of these families' overall lifestyles, and we'd like to see that. In addition to the tax supports for the middle class families, we talked earlier. I will tell you that the CCDBG grant, Child Care Development Block Grant, is key for these lower income families. And candidly, only represents about 5% of the industry, and quite frankly is falling woefully short of all the families in the lower income sector that would like to take advantage of CCDBG. So I'd say to you that that would be an opportunity for us to go even farther into what we believe is important. So I hope that answers your question.
Absolutely. And, I think I'm also struck as we're having the back to school debate and kids are heading back to school in various formats, that childcare is even more in demand now, if that was even possible. Are you seeing that on the ground? Is that true? Are parents leaning on you more heavily now that they've got these possibly hybrid or all remote options that they're dealing with for their school-aged kids?
The ones that have come back certainly are very dependent on our schools. They're working, they're working from home and need their child to be in a place where they can be socially and academically developed, and at the same time they can be at home and be productive. So yes, the families that have come back are certainly very dependent on our services. That being said, there's a number of families, as I mentioned earlier, that are financially impacted that simply can't afford to come back at this point. There are other families that are just reluctant. Maybe they have a family member that has a pre-existing condition and they're concerned about the exposure that may be in a child care center. So even though the health and safety protocols in our centers are world class, and they are clearly the number of cases that we have in our centers is a fraction of what happens in the states that we serve. So we've proven that our centers are a sanctuary for the kids, but there are still families that are reluctant. I mean, candidly, it's like flying, right? People are concerned about getting on an airplane at this point. The same is true about some families coming back to the center. So we're still struggling with occupancy at a time when our costs have gone up.
That unfortunately makes a lot of sense. Thank you so much, Tom. You've touched on a lot of really daunting challenges that your industry is facing right now, and also brought up some really important policy, both short and long-term policy changes that are needed, and that we look forward to, First Focus on Children, to working on as well. As we've talked about, childcare holds up our economy, and as that understanding continues to spread, we look forward to working on those changes that are needed to strengthen childcare and treat it like the public good that we all know it is. So thank you so much for your time today. I really enjoyed our conversation.
Thanks, Avery. It was a pleasure.